Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Bowel incontinence. Introduction. Bowel incontinence or fecal incontinence is the inability to control your bowels. It affects people of all ages. It is more common in women and older adults, but it is not a normal part of aging. People with bowel incontinence should talk with their healthcare provider. It is often caused by a medical problem. It can often be treated. This program explains bowel incontinence. It covers symptoms and causes of bowel incontinence. It also talks about diagnosis and treatment. The digestive system. The digestive system is also known as the gastrointestinal system. This section reviews different parts of the digestive system. It explains their structure and how they work. After you swallow food, it passes through the esophagus, also known as the feeding tube. It then reaches the stomach. The stomach helps to digest food. Digested foods travel from the stomach to the small intestine. The small intestine helps digest and absorb the food. Digested food that has not been absorbed in the small intestine reaches the colon or the large intestine. In the colon, the leftover nutrients get absorbed and stools are formed. The colon is made up of the following parts: the ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anus. Stools are then stored in the last section of the colon between the sigmoid and the rectum. The stools are eventually excreted or passed. Bowel movement. A bowel movement is the last stop for food in your digestive tract. During a bowel movement, stool passes out of the body through the rectum and anus. The walls of the intestines have muscles that contract and relax to push digested food through. These contractions are helpful for having a bowel movement. Intestinal muscle contractions are controlled by the nervous system. They are also controlled by the food you eat and the hormones in your blood. The muscles and nerves of the rectum and anus work together to control bowels by holding stool in the rectum, letting a person know when the rectum is full, releasing stool when the person is ready. Circular muscles called sphincters close tightly like rubber bands around the anus. The sphincters relax when stool is ready to be released. Pelvic floor muscles also help with bowel control. Normal bowel function can vary from 3 bowel movements per day to 3 per week. A bowel movement is considered normal if it contains no blood, is easily passed without pain or cramping, is well formed. If your bowel movements change, you should talk to your healthcare provider. Some changes can be a sign of a more serious problem. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Common symptoms of bowel incontinence are not being able to control the passage of gas or stools, not making it to the toilet in time. Often bowel incontinence is accompanied by other bowel problems, including constipation, diarrhea, gas, and bloating. For some people, bowel incontinence is a temporary problem. They may only experience it after having diarrhea. For other people, bowel incontinence can interfere with their daily lives. Talk to your healthcare provider if you have the symptoms of bowel incontinence. Bowel incontinence is often caused by a medical problem. Treatment is available. Causes. Bowel incontinence has many causes, including childbirth by vaginal delivery, diarrhea or constipation, inactivity, loss of elasticity or the ability to stretch of the rectum, muscle or nerve damage. Loose stools are difficult to hold in the rectum. Diarrhea increases the chance of not reaching a bathroom in time. Constipation can lead to large, hard stools that stretch the rectum. Watery stool builds up behind the hard stool. The watery stools can leak out around the hard stool. This leads to bowel incontinence. Injury to one or both of the sphincter muscles can cause bowel incontinence. If these muscles are damaged, they may not be strong enough to keep the anus closed and prevent stool from leaking. The anal sphincter muscles will not open and close well if the nerves that control them are damaged. If the nerves that sense stool in the rectum are damaged, a person may not feel the urge to go to the bathroom. Childbirth sometimes causes injuries to muscles and nerves in the pelvic floor. Bowel incontinence because of childbirth can appear soon after delivery. It can also appear many years later. Normally, the rectum stretches to hold stool until a person has a bowel movement. Rectal surgery, radiation treatment, and inflammatory bowel diseases cause the rectal walls to become stiff. The rectum then cannot stretch as much to hold stool. Inactivity can also cause bowel incontinence. People who are inactive may hold a large amount of stool in the rectum. Liquid stool can then leak around the more solid stool. Older adults are most likely to develop bowel incontinence for this reason. Certain medical conditions can also cause bowel incontinence. Some of these conditions include hemorrhoids, rectal prolapse, rectocele. Hemorrhoids are swollen and inflamed veins around the anus or lower rectum. Some hemorrhoids can stop the anal sphincter muscles from closing completely. This leads to bowel incontinence. Rectal prolapse is a condition that causes the rectum to drop down through the anus. Like hemorrhoids, rectal prolapse can prevent the anal sphincter muscles from closing well enough to prevent leakage. Rectocele is a condition that causes the rectum to fall into the vagina. It can happen when the thin layer of muscles that separate the rectum from the vagina becomes weak. Many women with rectocele have trouble emptying their bowels. This may increase the risk of bowel incontinence. Diagnosis. Your healthcare provider will ask about your symptoms and medical history. A physical exam will be performed. The provider may feel the inside of the rectum for problems. This is called digital rectal exam. One or more tests may be done to help your healthcare provider make a diagnosis. This may include imaging tests such as balloon expulsion test, anal ultrasound, MRI, defecography. Other tests that may be done include anal EMG, anal manometry, flexible sigmoidoscopy or colonoscopy. Treatment. Treatment for bowel incontinence may include the following: lifestyle changes, medicines, bowel training, pelvic floor exercises, and biofeedback. Lifestyle changes may include diet changes and exercise. Your healthcare provider may recommend eating more fiber and drinking more water. Medicines may help treat bowel incontinence caused by constipation or diarrhea. These medicines may include anti-diarrheal medicines, bulk laxatives. Bowel training involves trying to have bowel movements at specific times of the day. Over time, the body becomes used to a regular bowel movement pattern. This reduces constipation and bowel incontinence. Exercises that strengthen the pelvic floor muscles may improve bowel control. Pelvic floor exercises involve squeezing and relaxing pelvic floor muscles. Biofeedback therapy may help with these exercises. It also improves awareness of feelings in the rectum. It uses special sensors to measure bodily functions. If other treatments do not work, bowel incontinence may be treated with bulking injections or a vaginal balloon, surgery, electrical stimulation. Injections of bulking agents can make the anal walls bigger. This makes them less likely to leak stool. Another option for women is inserting a balloon into the vagina. This pushes against the rectum to prevent leakage. There are many different types of surgery used to treat bowel incontinence. The most common is called sphincteroplasty. This surgery is performed after childbirth or surgery. It reconnects the separated ends of a torn sphincter muscle. Other types of surgery may also be done. This depends on the cause of your bowel incontinence. Talk to your healthcare provider to learn more about surgical treatments for bowel incontinence. Electrical stimulation involves placing electrodes in the sacral nerves. The nerves are then stimulated with electrical pulses. A stimulator is placed beneath the skin. The person can turn the stimulator on or off at any time.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Bowel incontinence or fecal incontinence is the inability to control your bowels. It affects people of all ages. It is more common in women and older adults, but it is not a normal part of aging. Common symptoms of bowel incontinence are not being able to control the passage of gas or stools, not making it to the toilet in time. For some people, bowel incontinence is a temporary problem. For other people, bowel incontinence can interfere with their daily lives. Bowel incontinence has many causes, including diarrhea or constipation, muscle or nerve damage, childbirth by vaginal delivery, loss of elasticity or the ability to stretch of the rectum, inactivity. One or more tests may be done to help your healthcare provider make a diagnosis. This may include imaging tests and other tests that examine how the bowel is working. Bowel incontinence can be upsetting and embarrassing. However, people with bowel incontinence should not be afraid or embarrassed to talk with their healthcare provider. Bowel incontinence is often caused by a medical problem. It can often be treated with medicines and other therapies. Thank you for using Explain.